Hi everybody, it's Dr. Newman. I'm at a patient this past week who came in after having plastic surgery done overseas and came to me with some very significant complications. So I wanted to talk about it a little bit. I'm not saying that patients going overseas are going to doctors who are bad doctors, although the training of the doctors there and the certifications of the doctors wherever they're going might not be the same as it is in the United States or the same system that we have. I see many patients who go to areas where the system allows things to happen that just is not allowed in the US, or things that are regulated more in the US than they are there. And I think that when I see patients from these areas and I see a lot of the complications that come back, I get concerned. Because it's not that you can't go overseas and get a nice result. Lots of people do go overseas and get nice results. But I think for the most part, most of the things that I do as a plastic surgeon are things that you shouldn't really need to travel that far for. I understand that these things may be less expensive there, but on some level, there's you get what you pay for philosophy to some extent. In my operating room here in New York, I'm a Joint Commission Accredited facility here. And because of that, there are certain requirements that I must follow. That's not the case in many of these areas overseas. And because of that, there's just a certain quality control that goes into the way that things are done here and the way that I do them that people just don't have overseas. And because of that, the complication rate is higher. And when that happens and you're not near your doctor, that's a problem. So I think in general, unless there's something very unusual, most of the things that plastic surgeons do are not things that require people to travel that far for, other than the financial piece. And if it's that significant, then there's probably a reason for it.